IVM.
Hello and welcome to the Wire Talk. I am Siddharth Bhatia. Along with the COVID pandemic, not just in India but around the world, doctors are noticing a rise in mental health issues. Poor mental health has become a parallel pandemic, said Dévora Kestel of WHO recently. In India, numbers for psychological distress are rising, and the same has been noticed in Western countries such as US and UK, but also in our neighbor China. How do we address this? We have with us Dr. Rajesh Parikh, Director of Medical Research and Honorary Neuropsychiatrist at the Jaslok Hospital, Mumbai. Among his impressive credentials, such as the teaching psychiatrist at the University of Iowa College of Medicine, he has been invited to speak at many international universities and has written over 150 papers for medical journals. Dr. Parikh has been observing and writing on this parallel pandemic and is our guest today for this podcast.
Don't you love it when you're rewarded for doing something good? Cred is an exclusive club of high trustworthy individuals that offers the best products and experiences to those who do good. All you have to do is pay your bills on time. It's that simple. So don't miss out, just download Cred.
Welcome to The Wire, Dr. Parikh.
Thank you, Mr. Bhatia. Always a pleasure to be with you.
I read your recent presentation on this subject and the numbers seem quite worrying. I mean, that's an understatement, I feel. Is this being discussed beyond professional medical circles or also among policymakers, the media?
Well, you made a beginning. Most of the time, I would say, it's been confined to medical journals and academic meetings. Occasionally, some of us have been invited to speak to a larger forum, but I'm certain it's not getting the attention it deserves.
What about policymakers? What about bureaucrats, politicians, the government really, but not just in India, elsewhere? But let's focus on India for the time being. Is this something that has been brought to their attention?
I believe it has. How seriously it is being taken, one can only hazard a guess. But one cannot be judgmental in this. Currently, the government, bureaucrats, policymakers, call them what you will, have a lot on their plate. The ferocity of the second wave combined with the paucity of vaccination, which is perhaps the best way to arrest it, has enough concerns for them. And so I am not astonished that this is not a priority right now.
But even then, you'll want this to be go beyond medical professionals because it concerns the citizens. And it's something which, as I mentioned earlier, it's quite worrying and it could grow.
Oh, absolutely. It will grow, undoubtedly.
Okay. Can you put some of this in perspective? How does this compare with normal times or, shall I say, pre-pandemic?
Okay, so that's a good question. And perhaps two parts. Let me begin specifically with what you asked. To give you some data, in the United Kingdom, there is clearly a twofold increase compared to what it was around the same time a year before the pandemic. In the United States, there has been a fourfold increase in anxiety and depression compared to a similar period pre-pandemic. But if we were to also look at it in historical perspective, Mr. Bhatia, then previous analogous pandemic, SARS, for example, or MERS, have shown that these changes can persist for more than 3 years. So it's not as if the pandemic goes and the anxiety and depression miraculously vanish. In fact, they can persist for years. And the first great studies, and we're now sort of going back virtually to the birth of neuropsychiatry, was after the influenza pandemic, which occurred 100 years ago. And after that pandemic was over, it was found that a substantial number of those who had recovered from the pandemic had strange symptoms, not just anxiety, depression, which could be perhaps attributed as a consequence of the pandemic rather than as a sequel of it, but also illnesses like Parkinson's disease and obsessive compulsive disorder. And because the pandemic was 100 years ago, subsequently, when some of these patients died, autopsies were done of their brain, and it was found that the virus had resulted in changes in structures in the brain known as the basal ganglia, which control our mood and behavior. And so that actually established not just the connection between the virus and thinking, mood, behavior, but also between structures in the brain and changes in the behavior. And that, in a way, hastened the end of psychodynamic approaches and created or gave impetus to the field of neuropsychiatry. So there's considerable evidence historically and in the current pandemic that these are an integral part of the pandemic in addition to being a reaction.
So, how do we know while the thing is going on, while the second wave is still in progress? How do we know that when you say that it's doubled in the UK or 4 times in the US, how do we know that these statistics are A, accurate, and B, will remain more or less stable? Because, who's got the time and wherewithal to research these things?
Well, people like me have the curiosity and the enthusiasm to research it, and colleagues in the US and the UK have been doing just that. The data has been published in peer-reviewed journals. That's perhaps the highest standard you can have at looking at its statistical validity. And it's also compatible with what was seen in previous pandemics. So I wouldn't doubt the numbers. If at all, they may be less, but I wouldn't doubt them at all because they have been analyzed and they're reviewed by people who don't even know who has gathered the data. So I believe that's going to hold up.
And so, how do the numbers? What do the numbers say in India? Sorry, I'm going to rephrase that. Sorry. What about India? I mean, are you seeing research? Are you seeing similar jumps? Are you seeing particular trends?
Oh, absolutely. And there's robust data from India. The National Institute of Mental Health and Neurological Sciences, or NIMHANS, as is known in Bangalore, has published a slew of papers which seem to indicate just that mental health issues are on the rise in this pandemic, far beyond what they were pre-pandemic. But one of the papers also showed something interesting. It was not a comparison of what it was like earlier, but we know from other studies what that was like earlier. And it showed that about 80% of people in a survey, and this was an online survey, were ready to accept mental health expertise, were ready to approach mental health caregivers to seek help for what they were going through. Now, this is an astonishing leap in terms of acceptance, not just of mental health issues, but also of solutions.
So before I come to these specificities and what kind of cases that are emerging, are there any India-specific problems connected with our social and health realities, economic realities, and are they in any major way different from what's happening elsewhere?
Not to the best of my knowledge. I must, of course, disclose my limitation. My reading is largely confined these days to medical, neurological, epidemiological, and psychiatric journals. I am not into looking at sociological journals. I wouldn't be surprised if there would be data, particularly, with the gruesome things that happened to our migrant workers during the first wave. I would think there is data. I am not up to date on it.
But surely there must be some. I mean, I speak like a layperson, and in fact, this interview is by a layperson for lay audiences because I think there is a lot of interest out there and perhaps concern too. I speak like somebody who doesn't know this subject as an expert, but surely things like you know living together with a family, which in the US may translate as isolation because that's their social structure. Yeah, I speak in generic terms. And, not being able to talk to anybody. Um, so, surely there must be some role that India, culturally, socially, whatever, plays is plays a role in people's life.
Absolutely. I mean, that is even borne out by non-pandemic data. Mr. Bhatia, the reason I was being cautious is you people have worked very hard to establish a certain degree of credibility in what you publish or what you have on your podcast. I like to believe I've worked hard to establish a certain degree of credibility in my profession. And I thought that one shouldn't compromise each other's credibility by talking a bit loosely. And hence, I may have sounded a bit pedantic in quoting data. But in a looser sense, now that you kind of loosen the restrictions on the kind of conclusions one can derive without getting into data, current data that is, quite clearly the family has a role to play in social support systems. This has been demonstrated not just in our country, but even in cultures where the nuclear family is the norm, because even in those countries, there are families, extended families, sometimes three-generational families living together. So undoubtedly, the extended family has a role to play in support, and sometimes I might add in contributing to problems as well. But, there is a general isolation from everybody. And within families, we're quite clearly seeing that there is an isolation of the elderly. To give you my personal example, I have a dad who's 95. He's a brilliant gynecologist. He's done a lot of academic works. But we have isolated him in a separate apartment on the same floor where we live with an attendant to protect him from us. Because my wife and I are both doctors. We run the risk of a certain degree of exposure. We have young children in the house. So let's see, now we are a three-generational family. But within that family, the older person has been isolated. We kind of talk to him from a distance. So that may make it tougher. I don't know. I'm speculating, as you are, that is it more difficult to live with people and then be isolated within them? Or is it more difficult to be isolated and be used to that sense of isolation because, you're in a nursing home or somewhere else? I don't really know the precise answer.
You make a very good point. Actually, that was a very, very good illustration. I may even argue that that's an illustration in so-called normal times with people. My only reason for loosening the discussion, as it were, is obviously one knows of the seriousness which you bring to your work in terms of research, but also I think people would want to have some kind of idea about perhaps about what they should be looking out for.
Absolutely.
Yeah. So anyway, moving on. Specifically speaking, what are the kind of cases that have come to you? What are the kind of cases that you have heard of?
Okay. Predominantly anxiety, depression, and stress-related disorders. Now, there is a general angst, general anxiety, because science has always been two steps behind the virus, and I dare say policymakers have sometimes been two steps behind science, so therefore considerably behind the virus. And so every day brings a new surprise, and none of them are happy surprises. So there is a general anticipatory anxiety. or what's happening outside? Could it affect me? Could it affect my family members? Could it affect the elderly? And if it does, will there be a bed available? Will there be oxygen available? So this the general angst and anxiety caused by the pandemic. Then, of course, there is one in people who get a COVID positive diagnosis. So I think what's happening, Mr. Bhatia, is people forget very often, and like to use this opportunity to remind them that for about 90% of people, 85% to 90% of people across the world, the infection is a mild infection, somewhat like a flu. It takes a couple of weeks and it passes off. And that's what happens to the vast majority of people. Less than 5% of people need to be in an ICU, and the mortality figures are between 1 and 1.5% in people who don't have compelling comorbid conditions. But, this doesn't make for good graphics or powerful visuals on television. And so most of the time, the images that we see are of people in ICUs. Sadly, in crematoria, a lot of images of people being cremated. And I haven't seen a single image of somebody who just recovered with a mild infection and went about his life. So the moment a COVID positive diagnosis comes in, people anticipate the worst, and that fills them with dread. Thereafter, of course, there is the quarantining and the social isolation. So these are to be expected. What is surprising now is that post-recovery. You would imagine somebody who's been through a harrowing experience, not necessarily physically, because we've seen that many people have mild symptoms, but mentally. Partly because the fatigue goes off last. The fatigue persists for a few weeks after recovery. And one would imagine that somebody would feel great, that look, I'm a survivor. I've got through this. In a sense, I've been vaccinated naturally, but that's not what happens. People are left with residual symptoms. There are many theories for this. I've been even get into it because you cautioned me that we're having a general discussion. And in some cases, bizarre symptoms have appeared 6 months after recovery, such as psychotic symptoms, delusions, hallucinations. So we haven't yet seen the worst of the mental health issues. And as you hinted in the beginning, policymakers should be prepared for this.
Must be things like also job losses or worry about job loss or salary cuts. At the end of all this, will I have my job? Then you start working more and more, 24 hours Zoom, all that. I'm just trying to kind of paint a picture of, say, somebody who's young at the beginning of their careers or middle management, and they're constantly worried that I may not have a job after next month. And how will I? If you remember in the first pandemic, those were really among the major stories that were being done, that somebody or the other working in, say, the hospitality business was doing something entirely different and his family didn't know about it. So those must be also stresses of some kind. And that word stresses is the most kind of lay casual word that I can use.
Undoubtedly so. So when we wrote our first book on the coronavirus, when it was not yet a pandemic, there were few cases across the world and 0 cases in our country when we got started. In that book, we coined a phrase which is called cultural extinction event. So as you're aware, there have been 5 major physical extinction events, the last of which was 65 million years ago, which wiped out the majority of reptiles and dinosaurs and made it possible for small mammals to emerge, and which, of course, evolved into humans. And the reason you and I are talking today and harnessing technology to do that is because the physical extinction event wiped out a substantial portion of animal and plant life in this world 65 million years ago. So we coined a phrase, analogous phrase, cultural extinction event. And that has borne out now, a year and a half into the pandemic. We anticipated, as others have, I mean, we're not the first to anticipate this, that the entire culture would change, whether it's educational, whether it's occupational, and to an extent even social, post-pandemic, in a way that this would be a cataclysmic event. And we're seeing that's happening. You're seeing that organizations like TCS have already put up a certain percentage of their real estate on the block. They have predicted that most of their workforce will now continue to work from home. So that's a change. Going to office had its own socio-cultural effects, making people traveling, etc. So all that is changed. So we predicted in the book that this would be a cultural extinction event. Now, you may recall that in the 70s, Alvin Toffler published a book called Future Shock. And a lot of the predictions that he made in the 70s have all been borne out. And at that time, he predicted that the future was accelerating on us at an unprecedented speed. And that would take its toll on people's health. And that indeed has happened. But now the acceleration is super fast. So undoubtedly adapting to all these changes will take a toll. For instance, I didn't own a cell phone till a year and a half ago. Fortunately, my children persuaded me to start using a phone just before the pandemic. And now I've adapted to it. So that's not a stressful adaptation, though it was initially. But most people are going through changes which are far more catastrophic, both at work, in the home. You may be aware that there's data showing a 3 to 4-fold increase in divorce applications in our country. So, living together like this, constantly closeted in a room, isn't always as romantic as it is made out to be.
Yeah, I mean, these were things as the phrase you used, but these were things that were part of our social culture, going out, meeting friends, having a drink. In fact, even going for a walk, which has not happened here in this city. Meeting and talking to colleagues in the office. That is definitely a safety valve of sorts. And you complain about getting home very, very tired. But then on the other hand, now we know the advantages of that. I mean, I'll come to children later because you had a very, very interesting statistic. But children going to school are not being able to meet their friends. Now, have you or other doctors that you know, have you seen a vast difference in terms of issues, not numbers, but issues and the kinds of patients that you have met or heard of from the first wave?
I personally have not, but then, I may not fit into the general pattern of people who are in practice because, more than half my time is now devoted to issues related to pandemic rather than issues related to neuropsychiatry. I also have administrative responsibilities at the Jaslok Hospital where I'm Director of Medical Research, which means that I'm actually seeing fewer patients than I was seeing earlier, but mostly because I don't have the time. I, therefore, do not have a large body of personal experience to draw upon to talk about the difference between the second wave and the first wave. But of course, I do chat with my colleagues now and then. I do listen to their presentations. And if at all, it's increasing. I know in China, there's been a dramatic increase between the first wave and the second wave. To illustrate that, during the first wave, it was a little strange. The spectrum of prevalence of mental health disorders varied from as little as 7% to as much as 53% in some studies. But in the second wave, it's uniformly around 50%. So that's a dramatic increase between the first and the second waves. I would imagine, and I'm using the word imagine because I don't have hard data. The second wave is way too recent, Mr. Bhatia, in our country. I mean, it's barely 2-3 months old. So collecting data then subjecting it to rigorous statistical analysis, and then to peer review, which is the most important step in validating the data, is a step which takes months together. So I am not aware of data in our country during the second wave, but China had its second wave long ago, and there the data clearly indicates a far greater increase in the second wave than in the first.
You mentioned Europe in your presentation.
Yes.
I think what I read was, I mean, you can tell me if I have interpreted this wrongly, but that the number of children in Europe is high, but it's much less among the elderly. Why is that?
Yes, so you're absolutely updated on the data. And I think this was largely in Italy and in France, the study that you alluded to. And I think the data indicated that the disruption in their lives, children want to play all the time. You put two kids together, they will play with each other, even if they don't speak the same language. My wife and I used to travel, considerably around the world on for academic reasons. And, I would be surprised that how easily our children who were young then would play with other children without even having the same language. I was surprised once my middle son, who was about 5 years old, was talking away with somebody in Spain, and that boy, clearly spoke only Spanish, and they were talking Pokemon, and they were excited. They were talking the language of, cards and games. So children naturally gravitate towards each other. They play, and now they're suddenly deprived of that. They have to sit at home. Often, they are witnesses to domestic squabbles, and that takes a toll on them. So numerous things, are affecting children across the world.
But why the elderly it's less?
The elderly is less relative to children, not relative to themselves.
Okay. So, and they have presumably a very, very different set of concerns and issues.
It's ironic, isn't it, Mr. Bhatia? The elderly, especially in Europe, are already used to social isolation. They're already used to being by themselves. That's not happened just during the pandemic. It was there way before the pandemic. So paradoxically, the quantum of change, cultural change in their lives, is not as much as has been in the lives of children. Children have gone from one extreme to another. The amplitude of that range is considerably dampened in the elderly.
Coming back to India, for a lot of people, there may be, lack of information, awareness. There may be some stigma or just no access. They don't know how to find out who to go to. They probably go to a GP or friends and neighbors and presumably even families. There are people ranging in big cities. They may have some advantages, but some of the general issues may be the same. What is the person to do if they see themselves or their near and dear ones beginning to show signs?
So first of all, you bring up a very valid point. And just to give you an index of how terribly underserved our population is with mental health expertise, there are more psychiatrists of Indian origin in the United States than in India alone. And that's just one country. There are a lot of mental health experts from India who are populating universities in the UK, in other parts of Europe. So we are indeed considerably underserved to begin with in urban areas. And I think of rural areas, the less we speak, the better, because most of the mental health experts are in urban or semi-urban areas. In that context, what does one do? The examples you brought up in the beginning are not bad at all. Turning to your family, turning to your friends, turning to neighbors to talk to. And this has been studied in the past, very often works well in helping people to cope. But sometimes that is not adequate because it calls for considerably more expertise, particularly if one has to consider the options of medication. So again, an incredible thing has happened during the pandemic. I mean, there are some positive elements in it too. The first one I alluded to, that 80% of people were open in that study to accepting mental health. I did mention it was online only to indicate that obviously it was not a cross-sectional study of our society. I'm not sure how many people in rural India are usually online. So that clearly is a limitation of that study. But people are now accepting that it's okay to be anxious, depressed. The stigma is considerably less. Second, online services are now freely available. I do all of my consultations online. And I am, of course, pleasantly surprised how well I have adapted to it, but even more surprised at how much my patients love it. Some of them have expressed anxiety or maybe concern that they may have to do in-person visits again when the pandemic is over, and they want to know whether we could continue that. So, as a species, we are a remarkably adaptive species. If you look at other species around us, we are phenomenally adaptive, and let's not forget that that's a major strength of our species. That is what has got us where we are. That is why, even as we speak now, our satellites are all over space. We are on Mars. We're everywhere. So we adapt pretty quickly, and we have inbuilt resilience. So I think seeking whatever help is available is better than doing nothing. And mental health is now help is now available across the country. I have people talking to me from villages, and a lot of these services are completely free.
Okay, so this message is slowly spreading that it's okay to seek help, and people are responding in a positive way. Perhaps the combination of medical expertise and informal social interactions, talking to somebody, is the way forward. But now I ask you this for the sake of listeners, without intruding in any way on your expertise. But what are the things that a person should be watching out for in themselves, in people they love and care for?
Oh, that's such an excellent and important and practical question for all of us. So let's begin with what we should look for in ourselves. What would I look for in myself? One, if I was getting irritable, which I must confess I do from time to time. Two, if I was losing interest in daily activities, there has been a tremendous disruption of routine, and that in itself can be pretty disturbing. Then to see if there is anxiety, what we call free-floating anxiety, just worrying about everything possible. Then withdrawal, sadness of mood, tearfulness. In simple words, any change in oneself that one can see creeping up, not on a day-to-day basis, but perhaps on a week-to-week or a month-to-month basis. One should look for that in oneself. One should look for, now I'm going to lapse into jargon, but explain it. It's a word called anhedonia. And anhedonia means the inability to enjoy anything that's pleasurable. The inability to enjoy food, the inability to enjoy company, the inability to enjoy a good book, poem, whatever it is that gives somebody pleasure. So if one is not enjoying the usually pleasurable activities, then that's another sign. Of course, we look for these in people around us as well. Any sudden change in somebody around us, particularly in children, because they don't always have the vocabulary to express their feelings. So sometimes they behave erratically, they become aggressive, stubborn. So if one sees any of these changes, one should be compassionate enough towards oneself and towards the people around us to accept the possibility that this is psychological stress. This is not the person we know. And then take the steps to either talk to that person or help that person to seek professional help. What one should certainly not do is aggravated by getting annoyed with that person.
Yeah, that unfortunately in families is not always possible, as you can imagine. So it has to be a family management, a family understanding, family sensitivity. And I was just thinking of somebody while you were talking who's been calling me repeatedly and saying, you know, I'm middle aged and I think I waste my life just over socializing. I want to withdraw and maybe not meet anybody or meet very, very few people, even when things turn out. And, at one level, I think I can understand
Absolutely.
this journey and this destination. Perhaps there are people who are saying, this has given me time to think about myself. But on the other hand, isn't this shutting down of your social world also an extreme?
Yes, perhaps to some degree. But I think what you said is very, very relevant and very important. And I have talked about this in symposia in the past. So I believe it's a very valid point that the pandemic has given us the opportunity to reflect. Many of us have been so busy in trying to advance our careers, in trying to, get certain other kind of material pleasures, the joy of which, wears out very quickly, and have not thought about or not have had the time or opportunity to think about what issues really matter. Why didn't I meet my friends for so many years? Because I was busy pursuing my work. I was busy doing things that were urgent and not focusing on things that really mattered. And the pandemic has given us opportunity to realize that deprived of physical contact from our family and our friends, we now realize how really relevant that is. So I'm not surprised at the friend that you spoke of. I can, to an extent, identify with him. And a lot of people are realizing, a lot of my friends are realizing that, what really matters in life is not the promotion, not the paycheck, not the new car that you're going to buy, but your family, your close friends, your dignity, your personal dignity, your self-respect. And so people have had an opportunity to realign their priorities in life. And that may not be such a bad thing after all.
Is there something you, as a professional and an experienced professional at that, is there something you could tell people or somebody who came to you to say, look, there are ways to protect yourself as much as that is possible and, not fall into any of those categories. Of course, some of those may be things beyond your control, but in as much as it is there something that people should do proactively in order to keep themselves? Again, I say this, I know this is a very casual, much abused term, a little more positive.
Oh, absolutely. But I could tell you things, and they would be largely hypothetical. They would be based on what I've heard and what my colleagues are telling me. In my own mind, they would not necessarily be valid. So I could share a personal experience with you because that I do know to be true and valid, and that I have discovered things, interests that may have been incipient in the past, but never had an opportunity to come up. But now I've discovered, I mean, I've always enjoyed reading, but the joy of holding a book in my hand, of reading it, knowing that, there is nothing that I need to terminate it to rush in for other than maybe an online consult or a symposium or a chat, the kind that you and I are indulging in now.
Dr. Parikh, there must be physiological reasons too that make these things happen.
Yes, absolutely. And that's a very, very important point you bring up. And I'm glad you do, because people should not blame themselves or blame other people when they're depressed and withdrawn. There are 3 or 4 mechanisms by which the virus in fact, affects our behavior and our mood. For one, it gets direct access to the brain through the nerves of smell and taste, which is why many people lose taste and smell as part of their illness. Then the immune response that comes up in the body also crosses over to the brain, and cytokines, and it's a bit technical, but let me just simplify it and say that there are certain changes brought about by the virus in the structure, physiology, and of course the biochemistry of the brain, which result in this. So this then becomes an integral part of the illness rather than a reaction to it. And that certainly warrants compassion on oneself and on others rather than to feel guilty or annoyed. And the quickest thing to do is to seek help.
And you said that there is some level of help available.
Oh, much more than in the past. Considerably more in the past than in the past.
So, I mean, this so far has been an really, really very, very helpful chat. I think, at least some people listening to this may say that, okay, I didn't know what to do, but I have some idea. Specifically speaking, when you say there is health available, what should somebody, let's say, in a mid-level town, even beyond that village? I know you said that online people reach out, but specifically, is there something somebody can and should do?
Oh, absolutely. So now, these days, the cell phone penetration, internet penetration in our country has been very impressive. People in small towns and villages do have access to an internet connection, quite often to a smartphone as well, if not a laptop. So one has to just go online and, if you did it right now, you'd be astonished at how many such services, many of them pro bono free, are available. There are a large number of people just wanting to reach out. All of these may not be necessarily qualified psychiatrists or psychologists, but they're willing to help out. They're willing to listen to you. Sometimes all that one needs is a sympathetic ear, a compassionate person, somebody who understands your pain and who can also empathize with it in saying that, well, I'm going through it too, but this is what we could do together. So that is available across the country right now, and people should look for it. Then again, if one is in a smaller town, there is a high probability that there are a few mental health experts, qualified mental health experts there, and one might want to see them. So, given the ferocity and nature of this second wave, I would imagine they're all online. So now, if you're doing an online consult, you can reach out anywhere in the world, not just in your town, your country. There are mental health experts across the world. You may have read last week that physicians of Indian origin in the United States, and that's a substantial number. It's astonishing how many Indian physicians are doing incredible work in the US. They've made themselves available for online consult. So technically, somebody in a village, in a small village in Assam, could reach out to a mental health expert at Harvard at a click of a button.
And there is more than a chance that that expert in Harvard will respond.
Oh, absolutely. You'll be surprised. You'll be surprised. I reach out sometimes. Sometimes I'm foxed by something that I haven't come across, but I know that somebody at a top university in the US or anywhere else in the world has been working exclusively on that small problem. And I reach out to them and say that, look, you have far more experience in dealing with this rare syndrome than I do. Could you just share your thoughts with me? And you know what I've noticed, Mr. Bhatia? I've just noticed this. They respond far more promptly today than they would have, say, 2 years ago. Partly maybe because they're at home and do have time, but I think largely because they want to do something. All of us want to do something. We all would want to do something. Because at the end of the day, this pandemic is not about ourselves. Let us never, never forget that it started with one individual in a wet market in Wuhan and has now terrorized the world. So as long as any of us are unwell, each of us is at risk. We are in a sense connected as never before.
So finally, one of the other lines in your presentation, and I'm sure people are very curious about it, so perhaps it'll go on some public forum, or at least we have discussed it. One thing you said that was striking, that there is a grief crisis coming. Can you explain that?
Oh, absolutely. So it has been computed that there are 12 million people going through grief in the world. The 3 million deaths, each death leaves behind a certain number of people who grieve, more so in our country than perhaps in other cultures. So it's estimated that there are about 12 million people going through grief. Now, grief is a natural process. It takes a few weeks and then people get on with their lives. But there is what is known as complicated grief or pathological grief. This is grief which goes beyond the expected timeline and continues for months indeed. And there is evidence of that. And complicated grief is not only associated with anxiety and depression, but this is really important. It is associated with a diminished immune response. And in this pandemic, immunity matters a lot. So, we are seeing people who are in grief now coming to a higher risk, to being more susceptible to the illness itself.
Well, can you expand on that for a second?
Oh, absolutely. So let's say somebody has lost a dear one and continues to be in grief for months together. There will be anxiety and depression, which one would expect. But the immune response of that person to any infection, not necessarily the coronavirus, the immune response of that person to any infection is compromised. And the infection we're worried about the most right now, of course, is COVID-19. So complicated grief makes the people who harbor that grief more susceptible to getting COVID-19.
And you've seen that happen?
I have not seen it happen personally, but I've of course read about it.
So thank you, Dr. Rajesh Parikh, well-known neuropsychiatrist, and somebody who has tried to make a lot of his work, a lot of his views public. So thank you very much for this. I must say that even I have got many takeaways from this, but the main general takeaway is that people, their families, and combined with experts can help if you feel something's coming on. But even otherwise, there are ways to think about it and not think that this is, the end of the world. And with sensitivity, with medication, you can tackle these things. Dr. Parikh, I must tell you that the latter half of our discussion was full of hope and possibilities. So thank you very much for putting it all in context. And thank you for joining us to explain what's happening on the mental health front.
Thank you for inviting me to chat with you. As in everything that you do so well, you have steered this conversation all the way from starting with concerns to ending with hope. So you get more credit for that than I do. And do continue with the excellent work that you're doing, because that also adds to the information that all of us need to receive. I've enjoyed talking to you. Thank you so much, Mr. Bhatia.
That was Dr. Rajesh Parikh, neuropsychiatrist and head of the medical center in Jaslok, and talking about mental health and talking about how mental health can be a parallel pandemic. along with COVID-19. However, there are ways to understand it, deal with it, and if I may say, even tackle it. But he's explained what we should be looking out for. We'll be back again next week with another guest. Thank you for joining us at Wire Talk.
You can check out this podcast and other interesting ones on the Wire website, the IVM podcast website, app, or wherever else that you get your podcasts. Goodbye from me, Siddharth Bhatia, and the Wire Talks podcast team.
I hope you enjoyed that show. If you aren't following us on social media, please do. We're IVM Podcasts on Twitter, Facebook, and Instagram. We'd like to thank our sponsors on the network this week, Cred, Siet, TheWholeTruthFoods.com, and PayPal. We really do appreciate the support. On Cyrus Says, we discussed quite a bit about the local assembly elections this month. Vasanti Hariprakash was there to talk about the West Bengal elections, and then we also spoke to Pradeep Gupta, a psephologist and author. He's the chairman and MD of Access My India. Do definitely check that episode out. Great conversation. Tune into This Round Is On Me, where Gauri Devi Dayal caught up on the latest trends in the PR industry with Archana Jain from PR Pundit. On The Habit Coach, Ashton Dr. spoke to Anandita Chatterjee. She's the founder of Travel Chatter. She's been a marketer with some large firms and has traveled to 67 countries so far. It was a RuPaul Drag Race fan club on KBCD where Farhad and Sunetro discussed the show's best moments and talents. Amber Rana was joined by celebrity fitness trainer Shivoham on New Year Kanun to discuss fitness laws and regulations in India. They talk about the laws and infrastructure that exist to protect gyms, trainers, and also consumers in the fitness industry. And on the note with Maruk Inayat, we have clinical psychologist and friend of the network, Sonali Gupta. She talks about ongoing mental health issues like survivor's guilt, coping with anxiety around the pandemic, and doom scrolling. And with that, we hope to see you again next week.
Want to learn something new and have a few minutes to spare? Well, then go for the Traveling Professor's Diary, where I, Siddharth Deshmukh, the Traveling Professor, will help you glean from all the insights that I've gained from wherever I've traveled, learned, taught, and repeated. Join me every Tuesday and Thursday on the IVM Podcast website, app, or wherever you get your podcasts from.